Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Spinal versus the epidural anesthesia. So first we look at the spinal. So what is the spinal? So here spinal is nothing but the subarachnoid. So subarachnoid as well as the intrathecal. So subarachnoid as well as the intrathecal anesthesia. Now let's look at the level of the spinal anesthesia. So the level of the spinal anesthesia will be below, it will be below the L1. So it will be below the L1 as well as the L2, where the spinal cord ends, where the spinal cord will end. Next, where is the injection? So injection in terms of the spinal anesthesia will be the subarachnoid space. So it is nothing but the subarachnoid space, that is the puncture of the dura mater. So it is a puncture of the dura mater. It is a puncture of the dura mater. So how do you identify? So identifying the spinal. So the identification will be by, now we are only looking at the spinal. So identification is going to be by the CSF backflow. So identification will be the CSF backflow. So what is the dose? The dose is going to be low. That is 2.5 to 3.5 ml of 0.5% of the hyperbaric bupivacaine. So how is the dosing? The dosing here is going to be single dose. So there is going to be a single dosing. Now let's look at the onset of action. So when you look at the onset of action, the onset of action is going to be rapid. So by rapid we mean that it is going to take place within 2 to 5 minutes. Next is we look at the density of the block. So how is the density of the block? The density of the block is going to be more dense. Then how is hypotension? So when you look at the hypotension is going to be rapid. So this is going to be very rapid. So how is the complications in this case? So when you are looking at the complications, it is going to be high spinal. So complications are related to, it is high spinal. Then comes the cardiac arrest. So there is a cardiac arrest. Then comes a postdural puncture headache. So there is a postdural puncture headache is seen. So is there a post-operative analgesia? So is there a post-op analgesia? So in terms of a question on the post-op analgesia, the answer is going to be no. So this was about the spinal anesthesia. Now we look at the epidural anesthesia. So here in epidural anesthesia, it is nothing but the extradural. So epidural anesthesia is going to be extradural anesthesia. So what is the level of this? The level is at any level of the vertebral column. So epidural anesthesia is given at any level of the vertebral column. The spinal was given below the L1 and L2. So this is given at any level. So it is given at any level of the vertebral column. That is from the cervical to the sacral. So C to the S, the cervical to the sacral. Next is where is the injection inserted in terms of the epidural. So when you look at the injection of the epidural, it is at the epidural space. So the injection is given at the epidural space. So that is without the puncture of the dura mater. So it is without the puncture. So without the puncture of the dura mater. Next is how do you identify this? So identifying this will be by the loss of the resistance technique. So there is loss of the resistance technique. Then how is the dose? The dose of the epidural anesthesia. So the dose here will be high. So dose is going to be high. That is, it will be 15 to 20 ml. So dose is going to be 15 to 20 ml of the plain. So 15 to 20 ml of the plain bupivacaine. So it is going to be the plain bupivacaine, and it is going to include 0.1 to 0.5%. So 0.1 to 0.5% depending on the desired effect. So it depends on the desired effect. Next is how do you dose the epidural anesthesia? So dosing will be by dose. So dosing of the epidural anesthesia will be with a catheter in situ. So it will be a catheter in situ. So catheter in situ, and there is going to be multiple dosing. There is going to be multiple dosing, and continuous infusion is possible. And there is going to be continuous infusion. Continuous infusion is possible. So how do you look at the onset of action? the onset of action is going to be slow. Onset of action will be slow, that is 15 to 20 minutes. Whereas in terms of the spinal, it was very quick, that is onset of action was rapid, that is 2 to 5 minutes. Next, let's look at the density of the block. So when you look at the density of the block, in terms of epidural, it is going to be less dense. So in terms of epidural, it is going to be less dense. And when you're looking at hypotension, so in terms of the hypotension, so in hypotension, the epidural block is going to be very slow. It is going to be slower than that of the spinal. And let's look at the complications of the epidural. So when you're looking at the complications, this includes the local anesthesia toxicity. So it can be the LA toxicity. Next, it can also include the total spinal anesthesia. So it can include the total spinal anesthesia as well as the epidural hematoma. So it can include the epidural hematoma. Next is, what is a post-operative analgesia? So post-op analgesia. So post-op analgesia, the answer is yes, with the epidural infusion through the catheter. So with the epidural infusion through the catheter. To learn and grow daily like this, please do subscribe.